Good afternoon. Welcome to the Palm Beach County Emergency Operations Center. My name is Dave Kerner, serving as County Mayor. We're located, as I said, here at the Emergency Operations Center on our 30th day in the second year of our COVID-19 response at EOC Activation Level 2. It is April 15th, 2021. I'm joined by my wonderful colleagues. To my left, Commissioner Mac Bernard, Commissioner Maria Sachs. To my right and your left, Commissioner Marie Marino and Commissioner Greg Weiss. We're also joined by the normal leadership team. We have Dr. Alina Alonso from the Department of Health. We have our County Administrator and Incident Commander, Ms. Radinia Baker, and also CEO of the Healthcare District, Darcy Davis. As has been widely reported, I was vaccinated for my first round on Tuesday, and I feel wonderful. So far, so good. I'm excited to get my second round in a couple weeks. We wanted to convene this press conference in our ongoing effort to communicate directly with our constituents and with the press on our efforts in response to COVID-19. I want to take a moment of silence here, if I may, just because I spoke with some senior leadership at the Palm Beach County Sheriff's Office, and that we've had over the course of COVID-19, 7 PBSO employees pass away from COVID-19. The most recent employee that passed away last week was under the age of 50. We've had 5 employees in PBSO who were 49 or younger, and 1 was in their 30s. And I'll have some more comments on that after we just take a brief moment of silence for their service and their loss. Thank you. The reason I bring that up, it's not just confined to the Palm Beach County Sheriff's Office. The larger issue is that people 49 and younger that contract COVID can die. That's the first point that I want to make. The second point, which is probably more impactful in the sense that it's more widespread, are the effects that occur to that younger generation after they recover from COVID-19. And I mean neurological effects, I mean, I've learned today, psychological effects, and I mean physical effects, from migraines, headaches, loss of vision or blurry vision, lethargy. There's a host of issues that are coming to the forefront of COVID-19 about the younger generation. We call them long haulers. We have no idea how long these effects last. That's a very scary proposition. And so I encourage I encourage everybody to get a vaccine, but if you think you're invincible, you're not. I spoke about this during my vaccination process. Do it for your family, do it for your friends, do it for your neighbors, but do it for yourself. You don't want to get COVID-19 because the impacts after you recover from it can be very, very impactful. April 1st, we began the month with a positivity rate of 5.05%. This week, our positivity peaked at 7.13%. Dr. Alina Alonso is going to speak to some of the more specific and medical issues in the community, and it's my pleasure to invite her to the podium. Dr. Alonso.
Thank you, Mayor. Thank you, press, for all being here. Really appreciate it. The country's averaging around 70,000 new cases each day. This is up since mid-March. The period of rapid improvement ended late in February. Around 730 corona deaths have been announced every day, with the fewest in October. So, in other words, the cases are going up, the deaths are going down. Florida is one of 28 states whose cases have increased and remain increasing. As of 3 p.m. yesterday, Florida had 2.1 million positive cases. On 4/1, they had 12,092 new cases. On 4/12, they had 9,068 cases, and yesterday they had 6,772 new cases. So as you can see, it's slowly creeping up. That's not good. Likewise, Florida has 34,160 deaths since COVID began, and they only had 40 cases reported that were new. So again, this is consistent with what we're seeing through the nation. In Palm Beach County, our total positive cases is 137,132. As of yesterday, we had 454 new cases. The day before, we had 469. So they're slowly also creeping up our number of cases, although much slower and a much lower percentage. We have 2,704 deaths, and we only reported 3 new deaths. So we're consistent with what's going across the nation. So what are the demographics of both our cases, our new cases, and our deaths? 85% of our deaths have been in the 65 and older population. The other percent has been, as the mayor has stated, that young people can also die of COVID. At this time, we have vaccinated over 79% of that population. That's higher than the 5 other metro counties, including Broward, Dade, Hills, and Orange. The good new number of new cases is that the age in that group is only 7%. So the new cases in that 65 and over is only 7%. So that means that our vaccinations are working in that age group. So they're not going to the hospital and they're not dying. That's what I attribute the decrease in the deaths. On the other hand, 55% of our new cases are coming from the 15 to 54-year-old. These are not going to the hospital and not necessarily dying in the same proportion as the over 65. So this week, all our indicators are in the red. Total hospital bed utilization has gone up. Wednesday it was 77.6. The COVID hospital beds, 4.2. They had been down in 3%. Our total ICU beds are up to 70.2%. They had also been lower. And our total ICU beds in the ICU are 11.2%. Those had been much lower. Even our ventilator use went up. As of Wednesday, it was 39.7, but on Tuesday, it reached a high of 42.7. Our new cases per day, like I said, have been going up. The daily lab positivity, he already mentioned, has gone up, and our total positivity rate has remained high and continues to have gone up for several months now. It will not go down until we're down below the 5% like we were when we went all the way down to 2% at one point. So if we're going to be able to stop the spread of COVID, if we want this to end, if we want our businesses to remain open, if we want our schools to remain safe, we have to take the steps that we know work. We have to, in spite of the variants, we know that the vaccines work against the variants. That's another thing that's going up. In spite of the large gatherings that we're seeing, such as spring break, there's other large happenings across the county. People are having weddings. They're going to parties with large numbers of people. There's increase in travel. And many just simply think it's all over and they've stopped wearing their masks. So we must vaccinate, specifically targeting that 15 to 44-year-old that are creating the new cases. So vaccinating will help, but like the CDC said with the situation that's occurring in Michigan, vaccinating is not enough. We have to also take the steps to stop the spread with each individual person, continuing to wear their masks, continuing to do the right things, avoiding large crowds, and washing your hands, and watching out for one another. I thank Mayor Kerner for leading by example. It's not everybody that wants to see themselves getting a shot in front of the cameras, but it was more than that. It was to emphasize to the younger age group that does feel invincible how important it is to get vaccinated. Remember that what he said also about the complications, and I can't emphasize that enough, that we are seeing in younger ages. My message to the youth is, please, stopping the spread of virus is now in your hands. If you don't do it for yourself like he suggested, think about doing it for your family, your friends, and your community. And for the rest of us, we need to realize that this is not over. And if we want to keep our businesses open, if we want not to go into that fourth surge, we have to continue what we've been doing here in Palm Beach County. I thank you, and we'll wait for the rest of the people to speak, and then we'll take questions.
Thank you, Dr. Alonso, and I will remind the community that both Commissioner Melissa McKinley and Commissioner Maria Marino also went through that same public process, and they're doing very well. I had Commissioner Sachs rooting me on, and that was really cool. I appreciate your support. And so, this press conference is really to emphasize, like Dr. Alonso said, that 15 to 44. That's the chapter that we're in right now. And, in addition to all the concerns we've talked about, the other real issue that has gone somewhat unspoken is that 15 to 44 is the main carrier of this in our community right now. As they continue to spread that, the variants begin to multiply in our community, and the whole efficacy of the vaccination process is stopping that spread in its tracks. So even if you get through COVID fine and you're not a long hauler, we're making the spread and it's a good way to say this, the prevalence of these new variants, and we don't know how the vaccine responds or fights against those. We don't know the efficacy of the vaccinations against these new variants, and that's, for me, from a personal perspective, the most concerning thing, because we are so proud of our senior community that's at, I think, almost 80%. We're about to hit that milestone of 80% vaccinated, but we know the vaccination is effective against the main COVID-19. We don't know how effective it is against the variants, and so if we continue to spread that, I think there's a theory that can reemerge as a predominant one and really start to attack our senior or our elderly population as well. So please keep that in mind. It's now my honor to invite to the podium CEO of the Healthcare District, Ms. Darcy Davis.
Thank you, Mayor Kerner. A few weeks ago, we celebrated our 100,000th vaccination mark, and just yesterday, we surpassed the 150,000 shot milestone. That's 50,000 vaccines in less than 3 weeks. Some may think it looks easy, but I can assure you it is not. Our team of healthcare district professionals, along with our amazing partners at Palm Beach County Fire Rescue and Palm Beach Gardens Fire Rescue, have achieved an orchestrated precision that is truly impressive. Last Saturday at the South Florida Fairgrounds, we vaccinated over 4,000 people in one day. That's approximately 500 per hour, or just over 8 per minute. And despite that high volume, we continue to hear great feedback about how smooth and easy the process is. The hard work and unwavering dedication of each individual and agency who have helped support our vaccination efforts are keeping our community healthy and protected during this pandemic. The high turnout last Saturday is also a reflection of those in the community who understand the importance of getting vaccinated. So for those of you who have not taken the step towards immunity, please make an appointment and come see us. This morning at 9 a.m., we opened our scheduler for 16,000 first dose appointments of Pfizer. You can visit our website, vaccine.hcdpbc.org, and schedule a date and time that is convenient for you. Appointment dates are available between Tuesday, April 20th, and Thursday, May 6th. Those who are 16 years and older are eligible to self-schedule for the Pfizer vaccine. It's important to note that 16 and 17-year-olds must be accompanied to their appointment by a parent or guardian. So if you're eligible and want to be vaccinated, we encourage you to visit our website, schedule an appointment at either the South Florida Fairgrounds in West Palm Beach, the South County Civic Center in Delray, or the Burns Road Community Center in Palm Beach Gardens. Our website lists the available dates, times, and locations for each of those 3 sites. Our goal is to make these appointments as accessible as possible. We're offering Saturday appointments and continue to offer several weekdays with extended hours as late as 7 p.m. We hope these hours will benefit our younger residents who may be working or attending school during the day, so please don't hesitate, reach out. For those without internet access, the Healthcare District's helpline at 561-804-4115 is available to assist in English, Spanish, and Creole. In closing, we've worked hard to make this an easy process and exceed your expectations. So please visit vaccine.hcdpbc.org and help us reach our goal of community immunity. Thank you.
Thank you, Ms. Davis. All right, we have some important updates on our continued response to COVID-19 from the Executive Policy Group, which met earlier this week. Based on the local data and CDC guidelines, Palm Beach County's mask ordinance will continue for an additional month. That's 30 days. I understand that we are fatigued with COVID. We all are. We're fatigued with the masks. But we are, as I say, in the final chapter. Let's finish what we started strong. The Executive Policy Group is made up of and exists under the authority of the emergency order and is made up of the sheriff, the county mayor, our county administrator as the incident commander, Department of Health Director Alina Alonso, and our emergency manager, Mary Blakeney. We will reevaluate that. The board has been briefed on that decision, and we'll reevaluate it probably 25 days from now, and the county administrator will execute that order in the near future. As we've learned today and as we've seen, it's been reported recently that the effort to vaccinate has been, in Palm Beach County specifically, has been stalled by the Johnson & Johnson issue. Clearly, that's not the case. We have a very robust supply. In fact, there is increasing supply at the same time there's decreasing demand, which is not a good thing. We have all these centers to set up, or that we've set up. They're very effective. I went through it personally. You've seen it in the press. You've probably been through it if you've been vaccinated in this county. Very effective, very smooth process. Please get vaccinated. Please get vaccinated. We have been a leader in vaccinations. We've reached about 8% milestone for 65 and older, as I reported earlier. This was accomplished through partnership with the state and federal resources, and now our younger population, 18 to 65, should take advantage, 16 to 65, correct? 16 to 65 should take advantage of the vaccine. Let me remind the community of how robust our response really is. I want to point out the specific locations that we have. There are 67 Publix locations, which we know. We have one Winn-Dixie location in Lake Worth, 12 CVS pharmacies, 57 Walgreens pharmacies, 21 Walmarts and Sam's Clubs locations, the fairgrounds, the Burns Road site, which we appreciate Commissioner Marino's leadership on that issue, and the governor has set up specifically to make sure that access in minority communities is accomplished. Sites run by the state in Boynton Beach, Pahokee, Riviera Beach, and West Palm Beach. It has always been the vision of this board that we have a robust and diverse response in terms of vaccinations, and that is the case as it exists in Palm Beach County right now. I referenced the Pahokee site. There's a state-supported site at the Anquan Bolden Stadium in Pahokee. The state continues to have pop-up sites as well, but the state will report on those. We appreciate the governor's leadership on this issue, and we remain committed to having a diverse set of vaccination areas in our county. I was also speaking anecdotally with Ms. Davis about the amount of appointments that are made and then there are no-shows. I don't know if you have statistics on that, or did you report that already, but it's becoming a concern for the healthcare district, which means it should be a concern for the community at large. In partnership with the state and healthcare district, there are 7 remaining testing sites for COVID-19 in the county, as well as numerous private clinics and urgent care locations. In addition to the state and county-supported vaccination sites, we also have, I don't know how many, but it's got to be hundreds of private providers that are providing vaccinations to the community as well. So there's no reason not to get a vaccination, and certainly supply or the J&J issue is no reason not to move forward with this. I'd like to thank the governor and the Florida Division of Emergency Management for the flow of vaccines into our county. We must act now as there are appointments available, and we have an increasing amount of no-shows. I would like to recognize on a continuing basis the staff of our Palm Beach County Fire Rescue and Chief Duran for his leadership. Palm Beach County Fire Rescue and other community agencies continue to be a very important part to the healthcare district in the vaccination process, along with the Department of Health. That concludes my comments and the comments of the professional staff here today. Is there any commissioner that would like to make a comment? Otherwise, we can get into questions. Are there any questions? Hannah.
So school district officials have said that they plan to keep their mask policy in place for the next school year. Do you expect that to be the case in Palm Beach County for the fall, for the mask mandates to still be in place?
So the question that was posed by Hannah Morris from the Palm Beach Post relates to the school district's decision, although I know the Department of Education just came out with other guidelines, I guess, that suggests that there will not be mandatory masks in schools. I don't want to speak on behalf of the board or the executive policy group. I do think, in my opinion, that there will be, at some point in the near future, certainly not within the next 30 days, but at some point in the near future, we will repeal that mandate in this county. And we will rely on the decision, the personal decisions that the communities will make on their own.
And what kind of timeline is that in the near future? Is that
Well,
months?
Again, I'm not the ultimate decision maker, so it's a difficult question for me to answer. It's a decision that I will stand by regardless, and it's made with my input. and the input of the Executive Policy Group. The board can always take it up as the ultimate legislative decision-making body, but I don't foresee it going into, or in perpetuity, or into the full school year. Did you have further comments, Ms. Baker?
I simply want to, again, thank the public. We are where we are now with vaccinations, the spread. We want to continue that to go down and get it to a point where science supports us not requiring the mask anymore, and that we can continue to keep our businesses open and grow businesses. People are not going to come to Palm Beach County if we're all red. They're not coming. And we're not going to be able to go out to our favorite restaurants and participate in activities if we're all red. So it is going to be incumbent upon us to hold on just a little longer. And science, as well as giving people comfort level to go out, will continue to grow as people get vaccinated. So I think that we should allow the science, our numbers, to dictate when we no longer need the mask. And it's very difficult to project that just standing here today, because we don't know. We see our numbers starting to creep up again. Again, it's going to be incumbent upon us to get vaccinated, to wear our masks, to distance, avoid large crowds, and to sanitize. So we're constantly monitoring every day. If it comes to the point where we no longer need this mask, even if we have a mask in order, we can repeal that mask order at any time. But I think you as our residents, you as business people in our community, want us to take this slowly and make sure we don't have to repeat going backwards. That answer your question? Okay, thank you.
And just to add on to the incident commander's response, even when, whether it's symbolic or not, even when we repeal the mask ordinance or executive order, it doesn't mean that you shouldn't be wearing a mask in public. I mean, really, I think the vast majority of people wear the mask on their own decision, regardless of what the government says. And so when we get to that point, whether it's 7 days from now or 60 days from now, I still would expect this community to continue to be cautious and wear their mask and other mitigation strategies to stop the spread of COVID-19. Any other questions?
Mayor, what's the county doing or going to do with any Johnson & Johnson doses that are remaining now that vaccine has been paused?
The question relates to J&J, or the Johnson & Johnson vaccine. What are we going to do with those that are on pause? All of them are on pause, but those that are in our possession. I know the Palm Beach County Sheriff's Office has transitioned very quickly with the Department of Health and the Healthcare District to get Pfizer in there. Did you want to comment on that, or Darcy?
There's no problem, they're being held, there's no problem with the expiration date at this time. So if there were to be, we would exchange it out, and make sure that we have the vaccine with the proper expiration dates here. It's not an issue right now.
And further to the Johnson & Johnson issue, and I don't want to make light of anything that someone has gone through, but there were 6.8 million vaccinations through Johnson & Johnson, and there were 6 American citizens that had blood clot issues. I'm not a doctor, I'm not going to go any further than that, but I want you to know, and I want those that have taken Johnson & Johnson to know the real facts about what the concern is. The CDC and the FDA are evaluating it, and we trust their judgment, and we'll respond accordingly there. But the overall point is that that has not paused our response in any way. We have a large supply of Pfizer and Moderna. We have a very robust system of distribution, and we're excited to continue to have the community come and get vaccinated. Any further questions? Hannah.
So it's been a few weeks since the governor made this ban on so-called vaccine passports. Have you spoken with the business community about how they feel about this, support or not, and what are your thoughts about this?
The question relates to, and it's from Hannah Morris of the Palm Beach Post, about the vaccine passports and the business community's reaction. I don't have any comment, and it's just an issue of ignorance for me. I don't know a lot about that issue. It's a state and federal level issue, and I don't want to speak on behalf of the community or the business community. That would be something that they need to respond to directly.